There is one mistake travelers make before an international flight. They ask, "Can I take this medicine on the plane?" But that is not the real question. The real question is, what happens when customs finds it after I land? Some medicines are legal at home but restricted abroad. Some need documents. Some need approval before you fly. And some can cause trouble because of one hidden ingredient most travelers never check. This is where a prescription does not always mean permission. Picture this. You land in another country. You are tired. You pick up your luggage. Then a customs officer asks, "Are you carrying any medication?" You say yes. They ask to see it. Now the officer is looking at your pills, your bottle, your label, and the amount you packed. What seemed normal at home can suddenly become a border problem. In this video, we are counting down 7 dangerous meds you should check, document, or disclose when required before passing through international airport customs, and the last one might shock you. Number 1. Opioid painkillers. This includes codeine, tramadol, morphine, oxycodone, hydrocodone, and fentanyl patches. For many people, these are not dangerous drugs. They are pain relief. Someone may need them after surgery. Someone may need them after a serious injury. Someone may need them for cancer pain, chronic pain, or a medical condition that does not stop just because they crossed a border. But customs may not see the story first. Customs may see a narcotic. That is the conflict. To the traveler, it is medicine. To the border officer, it may be a controlled drug that needs proof, paperwork, or approval. And this is where many travelers get caught off guard. A medicine like codeine may be inside a pain tablet or even a cough syrup. Tramadol may be prescribed in one country but treated more strictly in another. Fentanyl patches may be medically necessary, but they can raise serious questions if there is no clear documentation. The problem is not always the medicine. The problem is the country you are entering. So before flying with opioid painkillers, keep them in the original pharmacy container. Carry your prescription. Bring a doctor's letter with your name, the generic drug name, the dose, and why you need it. Do not carry more than a personal use amount. And never assume that because your doctor prescribed it, customs will wave it through. Because a prescription does not always mean permission. But the next category is even more controversial, because millions of people take it every day just to focus. Number 2, ADHD stimulants. This includes Adderall, Ritalin, Concerta, Vyvanse, and other medicines made with amphetamine or methylphenidate. For someone with ADHD, these pills may not feel dangerous at all. They may be part of daily life. They may help the person focus, work, study, drive, or simply function through the day. But at international customs, the story can change fast. A border officer may not focus on the brand name first. They may look at the active ingredient. And if that ingredient is treated as a controlled stimulant in that country, the traveler may need more than a prescription bottle. This is why ADHD medicine is one of the most controversial travel categories. The traveler may think, "This is my treatment." Customs may think, "This is a controlled stimulant." Both can be true at the same time. In some countries, certain stimulant medicines may need advance permission before you arrive. In others, specific ingredients may be banned or tightly restricted. That means a legal prescription from home may not be enough. Before traveling, check the official medicine import rules for your destination. Check layover countries too. If the rules are not clear, contact the country's embassy, consulate, or health ministry before you fly. And keep everything in the original labeled container. Carry the prescription. Bring a doctor's letter that explains the medicine, dose, and reason. Because customs may not care what you call it. They may care what is inside it. But the next category is even more personal, because travelers may not want to explain why they carry it at all. Number 3, anti-anxiety medicines. This includes Xanax, Valium, Ativan, Klonopin, and the generic names alprazolam, diazepam, lorazepam, and clonazepam. These medicines are often used for anxiety, panic attacks, sleep problems, seizures, or muscle spasms. For the traveler, they may be private. They may be personal. They may be something they do not want to explain to a stranger at an airport. But customs may still ask. That is where the privacy conflict begins. A traveler may think, this is between me and my doctor. A border officer may think, this is a psychotropic or controlled drug, and I need proof. This can feel uncomfortable, especially when the condition is sensitive. But at a border, the question is not only whether the medicine helps you. The question is whether that medicine is allowed in that country, in that amount, with those documents. A few loose tablets in a bag can make the situation worse. A pill organizer may save space, but it can also remove the label that proves what the medicine is and who it belongs to. So keep anxiety medication in the original container. Carry your prescription. Bring a doctor's note if the medicine is controlled or if the country requires it. Pack only a personal use amount. Because legal medicine can look suspicious when it has no label. And the next category is often packed for the flight itself, but customs may still care after landing. Number 4, sleeping pills. This includes Ambien, Zolpidem, Zopiclone, Temazepam, and other medicines people use for sleep. Many travelers pack them for one reason: the flight is long. They want to sleep through the noise, the cramped seat, the time change, and the jet lag waiting on the other side. So the medicine feels normal. But at customs, normal is not the only question. Some sleeping pills may be treated as sedatives, psychotropic medicines, or controlled drugs, depending on the country. And if they are found loose in a bag, mixed inside a pill case, or carried without proof, they can raise questions fast. A traveler may say, I only use them when I fly. Customs may ask, can you prove they were prescribed to you? That is the part many people do not expect. The medicine may have been packed for the plane, but the problem may begin after landing. Before traveling with sleeping pills, check whether the destination country allows them. Check if approval is needed. Keep the medicine in its original labeled container. Carry a prescription or doctor's note, especially if the medicine is controlled. And do not carry random sleeping tablets from an old trip or someone else's bottle. At customs, convenience can look like concealment. But number 5 is the one most travelers never see coming. It is not a painkiller, not a stimulant, and not a sleeping pill. It may be inside ordinary cold medicine. Number 5, cold and flu medicines. This is the one many travelers never expect. It may not look powerful. It may not need a prescription where you bought it. It may be something you picked up for a blocked nose, sinus pressure, or a cough before a long flight. But customs may not look at the front of the box. They may look at the active ingredient. Some cold and flu medicines contain pseudoephedrine or ephedrine. These ingredients can be restricted in some countries because they may be linked to stimulant laws or used to make illegal drugs. That is why this category surprises people. A traveler sees cold medicine. Customs may see a restricted ingredient. And the brand name may not save you, because different countries sell different formulas under similar names. One version of a medicine may be allowed. Another version may not be. The small print on the back of the box may matter more than the big name on the front. Before you pack cold medicine for an international trip, read the ingredient list. Look for pseudoephedrine, ephedrine, or any ingredient you do not understand. Ask a pharmacist or doctor if you are unsure. Then check the official rules for your destination and any transit country. Do not throw random blister packs into your bag with no box, no label, and no proof of what they are. Because at customs, unidentified tablets can turn a simple cold into a serious question. But the next category may be the most debated of all. Some people call it medicine, while some borders may treat it like a drug offense. Number 6, CBD, THC, medical cannabis. This may be the most debated category on the list. In one country, CBD oil may be sold in wellness shops. In another, medical marijuana may be prescribed by a doctor. Some people use cannabis products for pain, sleep, nausea, anxiety, seizures, or other health reasons. But at an international border, that may not matter. Customs may not care that it was legal where you bought it. They may care whether it is legal where you landed. That is where travelers get into trouble. CBD can be especially confusing. Some people think, it does not get me high, so it must be safe to travel with. But some countries ban cannabis extracts. Some may treat CBD as a drug risk. Some products may also contain traces of THC, even when the label says otherwise. Then there are THC oils, edibles, vape cartridges, cannabis creams, and medical marijuana products. These can be legal in one place and completely forbidden in another. This is also where transit becomes dangerous. A traveler may think, I am only changing planes. But the airport is still inside a country's legal system. If your bag is checked, delayed, or inspected, or if you must pass through customs, the law of that country may apply. So the safest rule is simple: do not travel internationally with CBD, THC, or cannabis products unless the destination government clearly allows it and you have every required document or permit. Legal where you bought it does not mean legal where you land. But the final category looks less like a drug problem. It may come with a prescription, a cooler pack, and a needle, and that is exactly why your bag may be opened. Number 7. Injectables, medicines and medical supplies. This includes insulin, EpiPens, GLP-1 pens, semaglutide, tirzepatide, fertility injections, biologic medicines, syringes, needles, cooling packs, and sharps containers. These may be clearly medical. A person with diabetes may need insulin. Someone with severe allergies may need an EpiPen. Someone going through fertility treatment may need timed injections. Others may need biologic medicine that must stay cold. But customs and security may still ask questions. Why? Because this category often includes liquids, needles, injection pens, ice packs, and medical devices. Even when the medicine is legal, the supplies around it may trigger inspection. That does not mean you should leave important medicine behind. It means you should prepare before anyone asks. Keep injectable medicine in the original packaging. Carry the prescription. Bring a doctor's letter that explains the medicine and the supplies. If it needs to stay cold, keep the cooling items with the medicine and be ready to explain them. Now here are the mistakes that make all 7 categories worse: loose pills, pill organizers with no labels, carrying too much, no prescription, no doctor's letter, ignoring layover countries, assuming airport security approval means customs approval, and failing to check the active ingredient. Before your next flight, use this checklist: original packaging, prescription, doctor's letter, country-specific permit if required, personal use amount, and official rules for your destination and transit countries. And here is the question travelers rarely ask until it is too late. Should a legal prescription from your home country be accepted everywhere, or should every country be allowed to reject certain medicines at the border? Because before your next flight, do not only ask, can I take this medicine on the plane? Ask the question that matters more. What happens when customs finds it?